everybody to this session and discussion entitled Health and Humanitarian Consequences of Russia's Invasion of Ukraine. I'm John Samet, the Dean of the Colorado School of Public Health, and I, along with everyone, have watched with horror as this invasion of Ukraine has played out. I feel that it's a catastrophe and a public health disaster of such magnitude that we need to think about it and talk about it. And I invited the right person to help us with that conversation today, my friend and colleague from Johns Hopkins, Chris Beirer. As a reminder, Chris was actually our convocation speaker at a distance in 2021. Yeah. He is the inaugural Desmond M. Tutu Professor of Public Health and Human Rights at Hopkins. And I think really importantly, Chris has worked all over the world on issues related to health and human rights. A lot of it centered in his work in HIV/AIDS. He has extensive experience in Ukraine and Russia, as he will tell us. And not to go into the many things he's done, I'll just point out that he was president of the International AIDS Society from 2014 to 2016 and elected to the National Academy of Medicine in 2014. And Chris, thanks for joining us, and I'll turn things over to you. And for those of you who joined us, we really view this as sort of an opportunity to hear from Chris and then to have a conversation. And put your comments, I guess, into chat, and we'll follow through.
Well, thank you, John, so much. Thanks for the invitation and greetings to everyone. As John said, this is an enormous human catastrophe. It is also, of course, a public health and humanitarian crisis. And I think it really deserves our attention as a public health community because this is going to be, it already is, the largest health and humanitarian crisis in Europe since World War II. Before I begin, I just want to say that, of course, I think you all join me and we all share in really standing with the Ukrainian people, their extraordinary courage and resilience at this time. Hopefully some of you saw President Zelensky's address to the joint House and Senate this morning. Really an extraordinary appeal. And he, of course, has really come to stand for and represent really this extraordinary courage against this illegal, premeditated, massive Russian invasion and onslaught. So I want to talk about this as a humanitarian crisis. And I also want to talk about specifically two issues: attacks on healthcare and healthcare facilities, which are a very prominent feature of this war, as all of you know, but which are also part of Vladimir Putin's playbook in previous conflicts. He did this, bombed hospitals and schools, civilian targets in Chechnya in the early 1990s, and he has been doing this. Over 500 hospitals have been bombed in Syria when Russia and Russia's Air Force joined the Assad regime in bombing basically civilian areas that were resisting Assad's rule. So this is not to be understood as collateral damage. Just make that point right up front. This is deliberate. Right? It's a war crime. And we'll talk a little bit about accountability for war crimes. The second issue I want to talk about is COVID and the impacts of COVID-19 on these populations, because this is a very prominent feature of all of this. And you could argue that probably the worst thing to do in the world is to launch an invasion of another country during a pandemic. That's, of course, precisely what has happened. But just before I do that, I want to give a little bit of background on some of the work that my colleagues, myself, my Center of Public Health and Human Rights at Hopkins have done in the region, because I think that really will help give you some more understanding of what the motivations are here for the Russians. What is their agenda? What is their program, and what would likely be their program for public health in Ukraine should they prevail? So I actually got involved in Russia first. It was the first of the countries in the region I've worked in because I had a graduate student who had lived and worked there, was fluent in Russian. She was doing a PhD at Hopkins. I was fortunate to be her advisor. Her name was Julie Stahoviak. She's now deceased. But she had started with several Russian friends an AIDS service organization in the early years of the HIV epidemic in Russia. And I first went there and worked with her in the early 2000s. And she's the only graduate student I've ever had who said, I want to do my dissertation with the NGO that I started, and I want to write an R01 to the NIH to fund it. I said, you can't write an R01 as a graduate student. And she said, yes, I can. And she did. We did it together. I had to PI it, of course. We got it funded. And we did a longstanding project with sex workers. Russia has a huge sex industry in Moscow. And through that, I really came to, really make deep friends there and get to know a lot about what was going on and also learn more about the health system and the public health system there, which you have to understand is still profoundly Soviet and resists, for example, the idea of evidence-based coming out of randomized controlled trials. It was just extraordinary to me, the kinds of things that people were doing, hyperbaric oxygen therapy, orgone therapy, all kinds of things that have absolutely no basis in science. And in the public health arena, there was, for example, a vigorous opposition to the whole idea of substitution therapy. Their HIV epidemic was mostly in heroin injectors at the time, people who inject drugs, and methadone was banned, buprenorphine was banned, harm reduction, needle and syringe exchange was allowed only because outside donors were paying for it. And it was an enormously challenging space, but we were able to do quite a bit of work. We had a second R01 and a Fogarty supplement funded by the NIH for 5 years so that we could do more advanced training. And with that second R01, we set up what was really a huge unmet need, which was the first voluntary counseling and testing center, anonymous center for gay and bisexual men in Moscow. Turned out that there was a severe epidemic in gay men there, and they were very underserved, and nobody wanted to go through the government testing program because you go on a national register of people with HIV, and for example, that has impacts on student loans, on parenting, on travel, on a whole array of civil liberties. Not to mention, if you were gay and either disclosed that or the authorities found out about it, you ended up on a list of known homosexuals, which also nobody wanted to be on. So that program went on for a number of years. We had 1,500 regular clients. We were really, I think, having a big impact. But then Putin passed this anti-homosexuality propaganda law in 2014. We were forced to take down our websites. And then the harassment of our clients coming in and out of the clinic began with skinhead violence and threats, and then threats against the staff, who were mostly, as is the case across Russia, middle-aged women, big part of the healthcare workforce, and they were being intimidated and threatened. And at that point, we had to close the project. Then we continued to try and work and collaborate, but the next Russian law that Putin passed was that any entity in Russia that was receiving US federal money had to be declared a foreign agent. And at that point, we just simply couldn't collaborate anymore. We continued to work together with our Russian friends and colleagues in Kazakhstan, where we had 2 more R01s, in Tajikistan, where we did the first ever study of HIV in drug users and hepatitis C, and in Ukraine. And in Ukraine, we really found a completely different policy environment. Ukraine, of course, was facing Europe, wanted to be part of Europe, embraced the WHO guidelines for HIV prevention, were working hard to try and improve outcomes for LGBT people. And this became part of the Russian propaganda machine that basically Ukraine was headed down a pathway toward marriage equality if they stayed in Europe and violating traditional Russian values. The last time that I was in Kyiv, which was in 2017. I was there. We were doing a launch of a Lancet special issue that we had done on HIV, viral hepatitis, and tuberculosis in prisons and prisoners. And this was a regional launch. We invited people from all over the region. We actually had a huge number of Russians show up uninvited who were interested. It was something of a surprise. But the first day that I got there, which was July 29th, I'm going to now just screen share for a moment and show you a picture I took of the English language newspaper that was put on my breakfast table with coffee. Russia's war against Ukraine has killed at least 2,727 soldiers. And these black and white photos that you can see here are photos of Ukrainian soldiers killed in this region, Donbass, in eastern Ukraine. So this war actually began, the current war, in 2014 and has been going on now for 8 years. So Ukrainians know a lot about Russian tactics and Russian forces in their country. But this, for me, was such a wake-up call. It was the first time that I really realized that I was in a country at war and what the Ukrainians were up against and how little the world seemed to be paying any attention. This was not a story that was on anybody's radar screen at the time. So, fast forward to today, and I could say, just to give you one example of how much the Russians care about their ideological approach to public health, 2014, of course, not only was there that conflict going on already in eastern Ukraine, but 2014 was also the illegal annexation of Crimea, the peninsula that juts out into the Black Sea, southern Ukraine. When the Russians occupied Crimea, on the first day of the occupation, they stopped methadone. First day. Right? And that's such an extraordinary thing to do. You occupy somebody's country, that really the first thing you want to do is stop methadone. And there were, of course, then a number of people very quickly using again. There were overdoses. There were a number of suicides. Eventually, George Soros, the Open Society Foundation, which was active in Western Ukraine, sent a fleet of buses and got methadone patients who wanted to go out of Crimea so that they could continue their therapy. And I will assure you that if Russia prevails, these kinds of programs will be one of the first things that they will stop. So I want to talk to you now a little bit about the issue of attacks on healthcare and healthcare facilities, because this is, as I said, a very fundamental part of this conflict. WHO did not have a mechanism in the past and did not have a system to measure attacks on healthcare and healthcare facilities. The Safeguarding Health and Conflict Coalition, which is actually based out of our center at Hopkins, has been pressing WHO, and they finally, in the last several years, have begun to do regular surveillance. They now have a surveillance system for attacks on healthcare, and they have confirmed 31 attacks as of March 13th on healthcare or healthcare facilities, blood banks, cancer centers, of course, the maternity hospital in Mariupol that people are so concerned about. I just had an update from there, and I will share with you that there now appears to be something unique even for Russia, which is that they have occupied the general hospital in Mariupol. Soldiers are in it. They're using it to launch attacks. And the intensive care unit, which was moved into the basement, the patients in it and the providers are being held hostage by the Russian forces. So that is really new, using patients as hostages. The definition, the Safeguarding Health and Conflict Coalition has a definition for attacks on healthcare, and let me just share that with you. Any act of verbal or physical violence, destruction, or threat of violence that interferes with the availability, access, and delivery of curative and/or preventive healthcare services in countries experiencing conflict, if they are perpetrated by an actor in that conflict. So I think it's fair to say that that definition has been met. Now, so far, there has been terrible impunity for attacks on healthcare and healthcare facilities. There's actually only been, in international criminal law, one successful prosecution. And John, you'll probably remember this. Some folks may remember that during the horrible wars in the former Yugoslavia, that there was a moment where Serbian forces emptied a hospital and killed all the male patients. And the people who were involved in that attack are the only people who have really been held criminally liable. The Russian attack, Putin's attacks in Syria, have a special case. As I said, more than 500 hospitals and facilities were bombed in Syria when the Russians entered that campaign. But they also, the Syrians managed to create field hospitals and move many of them underground and down into caves and into the basements and cellars to try and continue to provide care. And so the Russians added actually the use of these special bombs. Let me get the name of it exactly. Yeah, they're called Bunkerbuster bombs. They're 1,000-pound bombs, and they are meant to be able to penetrate deeply underground. So they were blowing up underground field hospitals as well, just to give you an idea of how absolutely targeted these are, aimed at healthcare facilities. Now, why has there been no prosecution there? Well, of course, Syria invited Russia into that war. Syria is not signatory to the International Criminal Court. Russia is not signatory to the International Criminal Court. But more importantly, charges can be brought against an actor like the Russian Air Force in this case by Syrian civilians or by other governments. But if the parties involved are not signatory to the International Criminal Court, it goes to the Security Council. And of course, Russia sits on the Security Council, and so they have blocked every attempt at accountability. In the case of Russia and their bombing of hospitals and healthcare facilities and killing of healthcare workers in Chechnya, of course, Chechnya was a part of their country, so there was never even any discussion that the Russians would be held accountable for what they did there because of their veto on the Security Council. The important fact here, and this is maybe one of the most optimistic things I'm going to say in what is otherwise quite a dark talk here, is that Ukraine is signatory to the International Criminal Court. And the Ukrainians have already requested an investigation into Russian war crimes, including into the bombing of hospitals and healthcare facilities. And that investigation is underway. And John alluded to the National Academy of Medicine. I sit on the Human Rights Committee of the National Academies of Science, Engineering, and Medicine. It's a 3-institute committee, and we have also endorsed that in criminal investigation. Victor Zhao, the head of the Academy of Medicine, did a very strong statement on this. And so this may be actually one of the first times where there is accountability for these crimes. And accountability really matters because we cannot have it become the norm of conflicts that attacks on healthcare and healthcare facilities, on ambulances, on maternity hospitals is somehow a new normal. And it's a norm of war that we can live with. I don't think anybody honestly believes that or thinks it, but we have had just extraordinary impunity for these kinds of attacks. I want to just say also that there was a really interesting analysis by a Middle East scholar. It was just out from the International Institute of Strategic Studies. This is a scholar named Emil Hokian. And he was reflecting on these strategies of attacking healthcare facilities in Syria, which Putin, of course, has done so much of, and the implications of that for what is happening in Ukraine. And he said, essentially, there are 2 strategic objectives to this. You ask yourself, what in God's name is the justification for doing this? Well, he put forward 2, and I think they're both really highly relevant. The first is that part of what the Russians are doing is engaging in international diplomacy and is sort of engaging in discussions around the humanitarian issues that are underway, creating humanitarian corridors. All of that continued in Syria while the ground war was going on and the Russian objectives were still being met. So this is in some ways a stalling tactic to achieve the objectives of the invasion. The second, and this is really important, is to deliberately create a humanitarian catastrophe, not as a secondary outcome or a spillover of the invasion, but actually as a primary outcome. And that is to shift the burden onto the other side. So now Ukraine, its neighbors, NATO, the European Union, Poland, many of these other countries bearing the burden. And of course, you just saw undoubtedly that Biden has put another 800 billion into Ukraine aid as an enormous amount of money. And we're going to also, of course, pay part of this refugee burden. Already, over 2.5 million refugees have fled, 1.8 million of them in Poland. And there are something like 1.8 million internally displaced Ukrainians. The European Union, the Biden administration said 5 million were going to leave Ukraine. The WHO had put forward 4 million. The EU has just put out a new estimate, and they think 7 million will leave. People who left Syria, and there were many millions of them, are still in refugee camps, mostly in Turkey and in Lebanon, 10 years on. So, this could be a lasting crisis, and it is again, a deliberate part, I think, of the Russian strategy. Last thing I want to talk about, and then we'll hopefully have time for your questions and for discussion, is COVID. And that is important because Ukraine was having a serious COVID surge of Omicron in the winter, had really quite high case rates. Russia also has been having a severe COVID epidemic. And for those of you who are following this, you may have seen that the Global Burden of Disease Group out of University of Washington, they just put out a new paper in the Lancet on estimating the mortality from COVID. And basically it's an assessment of the excess mortality up through December of last year. And the country with the highest excess mortality worldwide is Russia, almost twice the rate of excess mortality of the United States. By their estimate, it's 374 per 100,000. So the region was already in trouble, and it was in trouble for some other very particular reasons. One is, many will remember that Russia wanted to be the first country to have an approved COVID vaccine. So they approved their Sputnik V vaccine before they did the efficacy trial. So again, completely discounting the way science is done, but also putting a cloud over that vaccine. It's actually a prime boost of two different adenoviral vectored vaccines, AD26 and AD5. And it may be a perfectly reasonable approach, and it may be a perfectly reasonable vaccine, but because it has been clouded in controversy, vaccine hesitancy is very high in the region. Ukraine, at the time of the invasion, had something like a third of eligible adults vaccinated, but with 7 different products, including the Russian vaccine and the Chinese vaccine, which we know has low efficacy against Delta and Omicron. And vaccine hesitancy is high in the surrounding countries, and vaccine coverage rates are low. So our expectation, and one should add, although it hardly needs saying, that in the context of millions of people fleeing and millions of people being displaced, that non-vaccine prevention is absolutely impossible in these settings. People are sleeping in subway stations. You have to remember that of the 2.5 million people who have fled Ukraine, half of them are children. And many of them are going to be children under 5 who are not eligible for vaccination at all. So there is the real potential for a COVID disaster. And we're also very concerned, of course, that the surveillance programs, such as they were, largely now in a state of collapse in Ukraine. I think that is on the horizon. Unfortunately, the other infectious disease that we're very concerned about is polio. Ukraine had already declared a polio emergency because of an imported case in January of 2022, but they then had subsequent spread. There were a number of cases. And now, of course, when you have 1.2 or so million children moving where there's limited access to water, hygiene, and sanitation, the potential for polio outbreaks is enormous. Measles outbreaks, of course, are always a challenge when you have huge numbers of children crammed together, particularly under stress. It's a standard practice to re-immunize refugee children with measles. vaccine if they're crowded together into camps. But this is going to be very, very, very challenging because people are dispersed all over the place in private homes and in many, many facilities. So war, of course, has always been a driver of infectious diseases. You only have to think about Spanish flu in 1918 and World War I to know that these are very intimate and profound relationships. But it adds, in a way, to the cruelty and the horror of what Vladimir Putin is doing, that he would, impose this and mount this invasion during a public health crisis, and one that is certainly going to add to suffering and loss of life. So I will stop there. I will say the last thing I want to share with you, because I don't want to be totally a downer, is that my friend who hosted me in 2017 as head of the Ukrainian Public Health Institute, a wonderful man who is safe and sound. He's over 60, so men over 60 are allowed to leave Ukraine. And when he got to safety, he sent several of us work with him a short email, and I'm just going to read it to you. Dear American friends, let me inform you, Ukraine is holding on. We are standing, resisting, and will never give up. Glory to Ukraine, shame to Putin's Russia. Just about says it.
Okay, thank you, Chris. And that does just about say it. Let me ask that your comments and thoughts go in the chat, and there's a request, and Austin or Bobby, perhaps you can say where the recording link will be, presumably on our website. Let me ask a couple questions, Chris, while there's some things coming in the chat, and please put more in, but two thoughts. Can you say a little bit about the capacity of Poland and neighboring countries about healthcare and public health to absorb so many people? I mean, providing basic services, food, shelter, and obviously lots of relief is coming in, and we probably. And then the second question is, I know we are all alarmed, disturbed. What, and probably contributing, as am I, to different pathways to bring funds to help. But what should our schools and institutions be doing? And I think what are your thoughts, and what's happening at Hopkins?
Well, to the first question, let me just say that these countries, many of them, by the way, are quite low income. So the poorest countries to emerge from the former Soviet Union, one of them is Moldova, a very economically stretched place, and also a place where there is an ongoing Russian occupation. They have one region, Transnistria, which makes them very vulnerable, and unfortunately, on most people's short list of the next place that Putin will go if he does prevail in Ukraine. So Moldova has taken, I think, close to, it's over 200,000 Ukrainian refugees. That is a huge stretch for them. Romania has taken large numbers. That's also a low income, much more fragile country. Poland actually has to be on the list of more kind of middle upper income countries in Europe. And of course, it's a NATO member and part of the EU. As is Hungary, which is also a wealthier country. So both of them have more absorptive, capacity, if you will, and it'll be much easier for the EU to deliver aid to those countries than, for example, it will be to reach people in Moldova. Or for that matter, obviously, people in Ukraine. The internally displaced in Ukraine are a huge and rapidly growing population. It's also true that Ukraine is one of the two biggest wheat exporters in the world, and obviously those exports have ground to a halt. Russia is one of the others. And so there is an expectation in the sort of food security world that there are going to be real challenges for a number of countries that are dependent on Ukrainian wheat. Egypt is a good example. Now, in terms of what schools and universities should be doing. I mean, first of all, I think obviously it's everybody's duty to be informed and to be current and to understand what is happening. So, events like this, I think, are really important. We did one last week, which was political scientists at Hopkins, including Ann Applebaum, who's a wonderful staff writer at The Atlantic, on the faculty at the Hopkins Agora Institute, and then myself talking from a public health perspective. And that was enormously helpful. It was helpful for me. She, for example, had never heard about, and said to me, what is the Russian resistance to methadone? Why would they do that in Crimea? So I think, this is a time to really get out of our silos and talk across our disciplines and help each other understand what is happening. I do think that there is going to be an enormous humanitarian need in these countries, and that if people want to get involved in humanitarian relief, particularly folks who have training in any clinical area, but also particularly in dealing with trauma and mental health issues, that this is going to be enormous. And there will be lots of opportunities there. There are a number of groups that are already on the ground. You may remember John Paul Spiegel from Hopkins. He runs our Center for Humanitarian Health. So he was recalled by WHO and is in Poland and is helping to stand up WHO's relief efforts. This is going to be an enormous unmet need. And I think it's important too to be mindful of the fact that it could go on for a long time. The EU right now is basically giving 3 years for people to be, get emergency protection. It would be unusually short if people were able to go home in 3 years. Unusually.
Let me go on. There's in the chat from Cameron. Two questions. Ukrainian refugees arriving at the U.S.-Mexico border, what might happen to them? Do you think they will be let into the U.S.? And then I'll go on to the second question after you.
Yeah. We're in an extraordinary place in terms of political asylum. Let me just say more broadly, and remember that many of the people seeking political asylum, including on the U.S. borders, are refugees from other conflicts and other wars, right? And settings of violence. I think almost everybody who's been through that experience will tell you that nobody leaves their homeland voluntarily, right? They're pushed by these kinds of factors. But the Trump administration compelled the CDC to invoke what's called Title 42 of the US public health law to stop asylum hearings and to basically turn people away based on the need to protect the American people from COVID. Now, we did this, the Trump administration did this when we were the most affected, COVID-affected country in the world. So it never made any sense from a public health perspective. It is one of the shameful policies of the Trump administration that the Biden administration has continued. Many of us, and pretty much every professional society that I'm a part of, has been pressing hard against this, including Physicians for Human Rights, and arguing, first of all, that it never had any political public health justification, but perhaps even more importantly, it's really an abrogation of our international treaty commitments on asylum. So Ukrainians would fit into, certainly many of them would have legitimate asylum claims, but the question is, are they going to be able to have asylum hearings? We have long, for example, had different policies depending on the countries that you come from, including particularly Cuban refugees, as many people will know, fleeing the Castro regime. So it may be that Ukrainians will end up being something of a protected class. I could see that happening quickly.
And let's see, Cameron's other question, which I'm sure you'll have thoughts about, is how can the U.S. help protect Ukrainian refugees from human trafficking?
So human trafficking has been a very big part of this region for a long time. Moldova, for example, this one fragile country, for a number of years, arguably its largest export was young women. Going all over Western Europe and the United States. So Slovenia is a country that has been involved in human trafficking, as has Ukraine. So I think it's likely to increase. You may know there's quite a particular issue with surrogacy, that Ukraine was one of the few countries that allowed Ukrainian women, if they wanted to serve as surrogates. We now have a number of children born to surrogate mothers who are stuck in limbo and trapped in this country. So the potential there for trafficking, I'm afraid, is very real. We have, strong anti-trafficking laws. Most of them really pressed in the Bush years, when this became a major issue, and when there was then an Office of Human Trafficking opened in the White House. That office, many people believe, was kind of ideologically controlled for a number of years. It needs to be really reinvigorated and enlivened in this setting. But there are also people who are going to be desperate to go and desperate to move from all of these countries. And are they going? Their families get to safety? Yes. And is that international human trafficking? In most laws, it is. It's just a reality.
So let's see, let me encourage others, just put your questions or comments into chat. And Chris, maybe a bit of a comment. I mean, another area where you've had experience, although it may be different in this case from others because of the location, but the public health challenges of refugee camps.
Yeah.
And, I mean, this is not, say, the Thai, Burma border, if you will, or Myanmar border, but it's something different. But what do you think we'll do?
Well, obviously, there's some unique issues. One, which has caused a lot of loss of life and is going to continue for a while, is the cold. This is a very cold place, and people are moving in what are often sub-zero temperatures, and there have been a number of losses of life already just to cold. So that is going to be an aspect. The second, and that's more in transit than on arrival, but nevertheless, it's a real factor. The second is, that people have attempted, and this has been a part of the Ukraine-Russia negotiations, to open these humanitarian corridors to get people out of besieged cities like Mariupol, Kharkiv, and others. And the Russians have shelled immediately after agreeing to these humanitarian corridors. So that makes fleeing more dangerous, certainly for civilians. And it is another aspect of the deliberate targeting of civilian targets to attempt, to basically break the back of the Ukrainian resistance. In the camps, what we're seeing and going to see, I think, is a very, very mixed picture, because people are going into private homes. They are going into all kinds of different facilities. They are coming into transit areas in large numbers, train stations, and then moving on from there into other places. So it's going to be a very different looking dynamic. The largest refugee camp in the world right now is the Rohingya camps, which are in Bangladesh. And they are, what you think of, these are Muslims from Burma who fled the 2017 genocide there, by the way, by Myanmar generals trained in Russia. Interestingly, that's where they do their military training. And those are, enclosed camps, 750,000 people in a very closed off small area. That's not how this is going to look, I don't think. It's already not shaping up to be that way. But as I said, there'll be real challenges, particularly for countries like Moldova Romania, who are, that just have many fewer resources.
It's a question that that you may have some information.
Yeah, yeah.
You see it?
Yes. So that is an incredibly important question. And let me just say that Vladimir Putin is waging several wars at once, but one of them is the information war. There's no question about that. And, that's his background, right? He was a KGB agent based in East Germany, watching with horror as the wall came down. So he is very much attempting complete information control in Russia. They have shut down what were the remaining handful of outlets where the Russian people could hear actual news. That includes radio, television, social media, Facebook. Many outlets have been closed. But the Russians are profoundly aware, of course, of at least some aspects of what is happening, because the ruble has crashed, because they can no longer get out of their country. Flights have been canceled to so many other places. Many Russian democracy activists and social activists are fleeing or attempting to flee. And I just heard this morning, I was telling John before we came on, from the PI of my Russian collaborations in country, that after 28 years, the organization that we worked with has been forced to close. They did have some assets in US dollars. The government insisted that they turn those into rubles, because they're desperately looking for dollars to shore up the ruble as it collapses. And so, the informatics of this conflict are huge. The Russian narrative, by the way, is, I'm sure you're all aware, is that this is a limited military operation to denazify Ukraine. That Ukraine is in the control of Nazis, and that the Ukrainian people are going to welcome the Russians as liberators. I think they grossly miscalculated how much national identity there is in Ukraine, how much resistance there is. They expected this to be over in 24 hours. Apparently, they got that spectacularly wrong. But nevertheless, the information is very tightly controlled. And you probably have seen these reports, quite extraordinary, where of course, lots of people have family in both countries, and there are lots of people who are mixed Ukrainian Russian, and they have relatives in Ukraine or relatives in Russia, and people reaching out to their relatives in Russia and saying, we're trying to get the kids to Poland, and we're trying to get the elderlies in the family to Poland, and Russian family members saying, well, why would you do that? There's nothing to worry about. Russians would never attack civilians. This is just a police action against these Nazis. Vladimir Zelensky, of course, is Jewish. He's the furthest thing from a Nazi. But this is the way information gets inverted, right, in an informatics war.
Great. Other questions or thoughts that anyone wants to add? I mean, I think, Chris, your knowledge of this area and this problem is, I think, very helpful to us. And I think it's a great opportunity to talk about this. I mean, I think the other sort of anxiety that I think the world is feeling beyond watching Russia is the nuclear saber rattling, which for some of us is traumatic because we grew up with it. And
so Putin has used small scale tactical nuclear weapons, as they're called, in recent atmospheric testing. So that is really a grave concern, because there is thinking that if things don't go according to plan, that he might, for example, use an atmospheric tactical nuclear weapon over Ukraine to, again, break the back of the resistance. That, I think, would be, an extraordinary kind of red line for NATO. But we've had red lines before. I have to tell you that I think one of the things that is really so disturbing about particularly the annexation of Crimea, which after all was an attack on a sovereign European country and an annexation, total illegal annexation of territory, that very little happened. Putin, I mean, I think the lesson that Putin learned from that is, the West is bluffing, and they're actually not capable of stopping me or interested. Unfortunately, the same thing happened with Syria and with the use of chemical weapons. We had said that the Obama administration at the time, that chemical weapons were a red line, a line in the sand, they cannot cross. They were widely used, chlorine gas used on civilians, killed a large number of people, particularly in Kurdish areas. And there were essentially no repercussions for the Russians or for Assad. So, you can't draw lines in the sand and then ignore them when somebody crosses them. The lesson for people is there are no lines in the sand. And I think one thing that I've seen, which has really been extraordinary and heartening, is that there's a number of Syrian activists and Syrian physicians, and there's a large Syrian diaspora of medical people, because there are a lot of physicians there, and there's already solidarity emerging and engagement with Syrians and Ukrainians around these attacks on healthcare workers. We were on a call about that just a few days ago. So, I think what we need is an end to impunity for these kind of attacks. If the suffering anything aside from their liberation from all of this, which is what we all want to see, hopefully it will also be that we really have an end to this tactic of attacking healthcare facilities and healthcare workers in conflict.
Certainly terrible. Well, I think we are, just give a moment to see if anybody has anything else they want to bring up or talk about. And just before I say thanks so much, but I'll just wait a second here and see if anything else comes in. There's so much to talk about. And I think we need you back on a weekly basis as this unfolds.
It's traumatic. It really is traumatic for everybody. As I said to you earlier, John, I heard from one of my Russian colleagues this morning, and she said, I can't believe after 30 years that Russia is back to 1990. Closed off from the world, closed off from information, back in this dark, authoritarian period. So, I'll just say that the Russian people are suffering too, and many of them do not support this. And for those that do, we really hope there are repercussions.
Right. I mean, unfortunately, if we wanted to be gloomy, the public health implications of this are global. And, you talked about food insecurity. Clearly, the Russians are going to take a major hit. Let's see, I see one last question here. And in any case, just to finish that thought, we will be watching and monitoring this. I think the question of what can be done and what the interventions are is going to be critical. Question from Lisa: can you speak to the number of Russians leaving Russia and how this might be contributing to the magnitude of the refugee population?
Yes, there are many people trying to get out of Russia, trying to flee. It's going to be increasingly hard for people to do that because people are not going to be giving visas and welcoming Russians in the same way. But certainly anybody who remains who's an opponent of Putin's, many of them are trying to get out and trying to flee. There also are some numbers. I think it's not so many, but it's in the tens of thousands of Ukrainians who have fled into Russia from on the eastern side, from the Donbass. Trying to escape the shelling. Well, it's hard to know whether that's because they're sympathetic or because those are the only corridors that were open to them. But there definitely is also movement in that direction.
And there's one last question. I don't know if you have an answer. I'm not sure I understand the issue, but I think it's how can a Jewish leader allow for the Azov battalion? Do you know what that is? To be
That
incorporated in that.
That I'm not familiar with, but I do see the question about conscription into the armed forces and concern about parents and young people. I think Biden, right now, the Biden administration's plan is to keep the US out of this conflict. What you're going to see is humanitarian relief, lethal support, weapons, ammunition, and so forth for the Ukrainian resistance. I don't think that at least for now, that there's potential for us to get into a ground war in Europe, which is what would really require troops. There is a potential for this to escalate. Biden has been trying, and Blinken have been trying to de-escalate as far as, ordinary civilians like ourselves understand what they're doing. And the real concern is that Putin is doing deliberate things like the bombing of the military training center right on the Polish border to draw NATO into this conflict. He wants nothing more than for this war to escalate. And so I think I don't know that that's necessarily going to happen. I will tell you that when the registration for the draft was put forward, and that was under Jimmy Carter's presidency, I was one of many people who protested against that, and I got trained as a CCCO, the Central Committee for Conscientious Objection, and how to help people become conscientious objectors. But Jimmy Carter said something very profound at the time, which was that we don't have an all-volunteer army. We have a professional army, which is really composed of mostly the rural and urban poor. And what that means is that because we don't have a draft, Americans are further and further removed from the military. You're either in the military or you're not. You're part of a military family or you're not. And part of his argument, which I think actually has some water, is that, for example, we never would have been in Afghanistan longer than Vietnam if we had a draft. We were paying people to low-income people to fight on our behalf, and it dragged on, for 17 years. So while I'm very sympathetic to the idea that nobody wants to be drafted necessarily, or very, only a subset of people do, it's also true that this is a structural injustice. We have not all been bearing equally the burden of America's military commitments. That's not what we've done.
That's for sure. Although I will say that I was in the last group of physician graduates to be drafted, and I was. Right. So, but that's a different matter. I think I want to draw everybody's attention to the information in the chat about the community building circle tomorrow, and Bobby's put the information there in the chat, and it's also been announced. So for those of you who are seeking an opportunity to talk about this, there's the Ukraine situation and its impact, and people have family members and acquaintances in Ukraine, and it's a devastating time. I have to say I was there. It's about 10 years ago to visit Chernobyl, and it's certainly a vibrant city, becoming more vibrant at the time, and perhaps just really beginning to emerge, and then later freed up to become a true democracy. So it's been an important changes. Chris, I want to thank you for just coming back and talking with us again. And you may find an email from me again saying, "Don't come back and talk to us." No, this has been, I think, so informative, and your insights and your knowledge of the region are, I think, really helpful as we try and put this into perspective. And I think about this individually, and think about this as a school and a community about how we can help. And again, there are many places that certainly financial resources are what is most helpful that we can all do right now. So thanks again so much. Thank you all for joining us today, and let's hope for a more peaceful world. Thanks.
Indeed. Thanks, John, and take care, everybody.
Yeah,
Tough times.
Thanks. Bye.
Bye.
Bye.